Hello, I'm Samantha Keeler. I'm going to provide peri-care and changing of briefs. Hello, I'm Sam. I'm your student HCA. I'm here to freshen you up and get you ready for the morning. I'm going to check my client's ID, identify my client. My client's name is Mrs. Smith. I will then hand sanitize. I'm going to check my client's care plan to make sure that my client doesn't have any allergies, how much assistance will my client require, and what size of briefs my client may need. Okay, I'm then going to raise the bed to the highest position. Or comfortable working position, or working height. I will then make sure that all my bed rails are low and that my brakes are on also. First thing I'll do is I have this fan folded linen to the foot just to ensure my client is comfortable. So these fan folded linens are much easier to work with for grasping as well as straightening out compared to a rolled up linen. I'm also just revealing the area that I'll be working with, so I'm going to provide privacy. I will have my client roll on. I'm going to remove my client's garments. I can either help them flex their legs or straighten them out, just to help expose the area. I will have Mrs. Smith lay on her back, and I will place a waterproof pad. This helps with making sure that we're not getting any water or anything in the bottom sheets. Okay, so I'm gonna put on gloves. I'm going to be removing Mrs. Smith's garments and briefs. So I will roll these in, making sure that it doesn't stick to the client's skin. Just helps remove the brief. I will then check my client's skin and make sure that she does not have any redness or skin cut wounds or skin tears, discharge, and any pain, any abnormal discoloration, open cuts or anything. I will then also use the acronym COCA, consistency, color, amount, color, odor, consistency, and amount of contents in the brief. I can also use my brief to wipe any contents. I can also use a toilet paper. I will then roll my client on her back. Remove her briefs. Client's falling apart. Okay. I am gonna roll this up, making sure all the contents stay within the brief. And I'm gonna use these tabs just to help keep everything in place. So I've just removed the brief. Now I'm going to do pericare. So here I'm going to have my basin close to me. This helps with preventing any back strain. I also have here my peri cream, my peri wash, my cola, and the water. I'm going to put water in the basin, ensuring it's not too hot or too cold. The temperature should be 40.5 to 42.7. So I've checked the water temperature. I am then going to roll ahead and start my pericare. I'm going to have this folded like a mitt. I'm going to put some pericare. With this stuff, you don't usually need to rinse, so it's quite nice. Alright, so first things first, we are going to do we're going to open up the labia and do the labia majora, starting from moving downward from top to bottom in one stroke. So 1, and then I will do the same on the other side with a different part of the cloth, so moving downward in one stroke from top to bottom. Then I will do the same step as the manner above. I'm going to start at the top, opening the labia and doing the labia minora. I'm going to clean downwards, starting at the top to the bottom, using a clean part of the cloth. And same thing on the other side, starting at the top to the bottom in one stroke. I will then opening the labia in one downward stroke from the pubis closest to me, in one stroke downwards to the anus. So ensuring that I've done that. Using a different part of the cloth, or as many cloths as needed, until it's cleaned, and making sure that I use a different part of the cloth each time. I'm going to then again open the labia, and I'm going from a downward motion to the center. From top to bottom, I'm going to do the clitoris and the vaginal offerings. Once I've done those, I can rinse using a clean part of the cloth. From top to bottom, I can just rinse and use a clean part of my cloth in a downward motion from top to bottom as well, and the sides also. So using a different part of the cloth this way and that way. I'm rinsing this as many times as needed for the client until it's cleaned. I'm gonna do groins. So starting from the closest one to me, then the outside. Then I will pat dry. I'm going to make a cloth like so. Using a clean part of the cloth, I will then wipe and then wipe again. Using a clean part of the cloth, I will then just gently pat dry. This is a sensitive area, and sensitive if you are pat drying, you don't want to rub the skin since it's very delicate. Okay, so once I've cleaned up the area, I can then cover my client. Ensure that the bed rails are off if I leave to change my water for any reason. I'm going to hand sanitize because now I'm going to put on a new pair of briefs. I should be removing the gloves, using proper removal of gloves. So just remember that I am first taking this and then putting it in my hand and then removing the other one with my 2 fingers. Okay, awesome. I'm going to put on briefs on Mrs. Smith. Oh, actually, I'm gonna get Mrs. Smith to lay on her side, on her back, because I'm gonna do her buttocks. So, using so when I am doing I'm using the cleanest and dirty technique just to prevent any pathogens from introducing into the urethra and the vaginal area. As well as if I'm doing the buttocks, I'm going to be cleaning in circular motion, starting at the top, then the bottom, and then using a clean part of the cloth. I will then start at the vagina to the anus. I'm doing it this way, so cleaning from the vagina to the anus, because I'm trying to prevent any pathogens from the vagina to the anus. Any bacteria or anything that can be transmitted. So there, I've done the buttocks. I can open up the buttocks, and I'm just gonna do cleaning and doing pat dry. So I'm gonna pat dry from cleanest to dirtiest. So once I've done those things, I'm gonna put on a clean brief. I can change my gloves because if they're too soiled or dirty, I can hand sanitize and put on a clean pair of briefs. But I will also need gloves because I'm dealing with any bodily fluids or secretions, any blood. So then we place this here. Have my client be as comfortable and responsive. Ensuring that these elastics are properly aligned with the waist and the groins. My client falling apart. Alright, so once I've aligned it, I'm gonna ensure I have comfortably aligned it, and I am using the tabs from top to bottom, bottom to top, in a crisscross. Same on the other side. I'm using these tabs in the crisscross motion, crisscross. And then I'm going to make sure that I have these this folds, these folds crease. What's it called? Gathers. These gathers in place. Okay. I will then cover my client, make sure she's comfortable. I'm going to then clean my basin, clean my overhead table. I'm going to ensure my supplies are put away. I'm washing my basin. I'm gonna make sure that all my linens and biohazardous contaminated products or equipment are all put either in the disposable or the hamper. So I will make sure my client is comfortable. I've put all my equipment away so it's easier to get access to it next time. I then clean the overhead table. I can then remove my gloves. hand sanitize again. I'm gonna put a call bell within reach so my clients can get in touch with any of the healthcare professionals. I'm gonna make sure her bed rail is up, all her 4 bed rails are up, her brakes are on, and follow what the policy is. And I'm gonna remove any privacy measures. I can then record and report. I'm gonna be reporting anything that I observed in the contents and her skin condition. I can then ensure she's comfortable, and I've given her all the care that my client requires. So that was Peri Care and removing briefs